Hello everyone. My ethics presentation is on utilizing treatments for persistent vegetative state patients. And the landmark case that I chose for this project is the matter of Jobs, 1987. The landmark case that I chose, the matter of Jobs, took place in 1987. Just to give you a brief summary of this case, it first starts with a 31-year-old woman who is 4 months pregnant. She gets into a tragic car accident. As a result, she loses oxygen to her brain and she also loses her baby. Because of this tragic accident, she is diagnosed with persistent vegetative state. After a long time without any improvement, her husband decides to remove her J-tube, the treatment that is keeping her alive. However, at this time, she is in a nursing home, and the healthcare providers refuse to remove this tube because it supports the life of Mrs. Jobs. However, Mrs. Jobs is moved to hospital, and there Mr. Jobs requests the removal of the tube. The healthcare providers at the hospital agree to remove the J-tube, thus ending the life of Mrs. Jobs. Now, the stakeholders in this case are all patients in a persistent vegetative state. Now, with the patient who is in a persistent vegetative state, has minimum brain function. Even though there is severe brain damage, the patient is still breathing and that their heart is still beating. Because of this, they have a blood pressure as well. The area I focus on is how to treat patients, thus preventing complications, since there is no actual cure for persistent vegetative state patients. The most important issues in this case is not preserving the life of the patient with persistent vegetative state. In this case, it states that the hospital healthcare providers were willing to detach the J-tube, thus ending all source of nutrition and hydration for the patient. However, on the other hand, the nursing home healthcare providers were doing all that they can to maintain the life of the patient. They were striving to avoid the complication of malnutrition and dehydration because they desired to keep the J-tube in and they refused to remove it from the patient. The significance of the topic that I am addressing is preventing complications for PVS patients. Because the patient is breathing, has a heartbeat, and a blood pressure, they have every right to be considered living. It is the healthcare provider's duty to ensure that complications are prevented from occurring. Because patients who are in a persistent vegetative state, they are unable to move. And some ways to prevent complications are to frequently reposition the patient to prevent pressure ulcers. Because the patient with PVS is at risk for aspiration, the airway should be maintained with the air compressor to prevent this complication. Also, a patient with PVS is at risk for developing contractures. Therefore, physical therapy should be promoted to patients with PVS to prevent the complications of developing contractures. Equal medical assistance should be delivered for all patients with PVS. Because all patients are considered alive that have PVS, justice should be ensured by providing medical assistance to maintain the life of patients with PVS. Another important issue in this case is determining the quality of life for the patient. Now, the quality of life revolves around the idea of the comfort and standard of the patient's health. Therefore, by preventing these complications, the patient's comfort and their standard of health will be maximized. The thesis for my project is, as a reflection of the dignity and value of every human life, healthcare providers must provide care for all patients including those in persistent vegetative state. Now, the topic of justice is a major point in this topic. Justice is ensuring equality for all patients. In this case, the patient with persistent vegetative state did not have equal medical assistance because the hospital healthcare providers refused to allow the patient to have the J tube kept in place. Because of this, the patient has no source of nutrition and hydration. However, regardless of the prognosis, patients should have equal amount of care. With patients with PVS, preventing complications is a priority. The second conflict is beneficence. The nurses in the nursing home had their priority to save the patient's life by caring well for them and administering competent care. The third conflict is utility. Utility is performing the greater good in these kinds of situations. This revolves around the fact of determining the quality of life. However, the quality of life cannot be determined by the patient with PVS because these patients are unaware of their surroundings. Another idea that falls into the conflict is determining where the medical resources should be distributed when they are limited. However, this is my counter argument. The medical resources should be given where there are least amount of complications present. Now, if a patient with PVS has limited medical complications, resources should be distributed to that patient. The Code of Medical Ethics states that the physician should be responsible to be devoted to providing competent care. Therefore, physicians who treat patients with PVS should have the right skill to treat these patients. The Code of Ethics for Nurses emphasizes the idea of practicing respect for patients. Because every patient has worth, the nurse should have the duty to respect each patient despite their prognosis. Mrs. Job was transferred to the hospital. There, Mr. Jobs requested that his wife's J tube should be removed, thus ending the life of Mrs. Jobs. This legal outcome does not line up with what I regard as the best ethical outcome. I believe the life of every patient should be preserved with assistance of medical treatment. Even in the case of PVS where there is no cure, I believe that just preventing complications should be the priority of the nurses. One solution for this topic is to advocate specialized nursing care for PVS patients. This should be done by ensuring specific skill of how to provide competent care for patients with PVS. Another solution would be PET studies, and this just allows healthcare providers to determine the degree of awareness for each patient with PVS. As I stated earlier, patients with PVS are considered to be alive. For example, as I stated, they have a heartbeat, they are breathing, and they have a blood pressure. Therefore, the nurse has a responsibility to ensure worth in these patients with this prognosis. The nurse has a duty to care for these patients. However, because there is no cure for PVS, the nurse's goal is to prevent complications for these patients. As I stated previously, some of these complications to prevent them is to prevent pressure ulcers, aspirations, and joint contractures. Now with that, I would just like to conclude this presentation. Thank you for listening.